Atrial fibrillation doesn't just affect the heart, it affects the mind. Anxiety, worry, and even fear about what it's going to lead to in the long term. Every time you feel the symptoms, you feel like you're going to die. Every day your heart beats, you wonder whether you're going to develop a stroke. And of course, today we need to speak honestly and openly about that emotional weight that people with atrial fibrillation suffer. What if something happens? What if an episode starts during the night, so far from help, and no one's around to deal with it, apart from me? Some feel panicked during the episodes, others just feel depressed, frustrated, or limited by the diagnosis. These are all natural reactions, and no one is alone in feeling them. Education helps. Understanding atrial fibrillation makes it less mysterious. So does having a clear plan and knowing when to seek help. Some find benefit in mindfulness training, light exercises, or support groups. And I would really recommend that you meet other people with atrial fibrillation and speak to them about the way it makes them feel. Others benefit from short-term counselling or even short-term medication. Your mental well-being is a critical part of cardiac health, you see, and when fear is reduced, often your atrial fibrillation is reduced. Now, if you've been newly diagnosed with atrial fibrillation, it's really important that you understand whether you have an opportunity for that atrial fibrillation to be eradicated. So if there was one question that you might wish to ask your doctor, it would be that one. If we can eradicate atrial fibrillation early in its pathway, that's always going to be the best way forward.